When a hiring manager asks, what is the difference between eligibility verification and prior authorization, they are not only checking if you know two terms, they are actually testing, do you understand the patient access process? Do you know how claim denials happen? Can you connect your work with revenue protection? Do you understand how your role impacts the provider's payment? A beginner simply explains definitions, but a professional explains the business impact, how each process affects the revenue cycle and protects the provider's revenue. That's the difference between an average interview answer and an interview winning answer. So, to answer this question, first you have to understand the story behind these two processes. Imagine a patient walks into a hospital for an MRI. Before the provider performs the MRI, the front desk or patient access team verifies the patient's insurance eligibility. They typically check questions such as, is the patient covered by insurance? Is the insurance policy active for the date of service? Are MRI services covered under the patient's health plan? If the insurance is active and the service is covered, the patient is considered eligible for that service. But that's not enough. Some services, such as an MRI, CT scan, surgery, high-cost medications, or specialty treatments, also require prior authorization from the insurance company before they are performed. The exact requirement depends on the patient's health plan and the payer's policy. Now imagine the patient's MRI requires prior authorization. The provider verifies the patient's eligibility but performs the MRI without obtaining approval. In that case, the insurance company may deny the claim with a no authorization CO-197 denial. Why? Because the patient's eligibility was verified but the required prior authorization was never obtained. This is exactly why both eligibility verification and prior authorization are critical in revenue cycle management. One confirms that the patient has active insurance coverage, while the other ensures the payer has approved the service before it is performed.